Good afternoon, everyone. My name is Kelly Caseman. I'm the Executive Director of Think Kids, and I'm happy to welcome you to the final session of the 2022 Health and Hunger Summit Series. This is a virtual series as part of a larger project where we take a candid look at connections between the healthcare system and community resources that address hunger. For this series, again this year, we're focusing primarily on southern West Virginia counties. Health and hunger are profoundly connected. Their systems should be too. You can find more information on our website, thinkkidswv.org. So let's go ahead and get started. Feel free to type questions or comments in the Q&A while they're fresh in your mind if you'd like. We'll get to them as the conversation progresses. And with that, let's get underway by thanking our sponsor for the event series, the Palatine Foundation of Huntington, for their generous financial support again for this year's project. If you are a nonprofit that serves their foundation's service region and have a mission to advance transformative health initiatives, we suggest you visit their website to learn more about their important work and grant opportunities. We appreciate the opportunity to work with them and their supportive work like this. Let's begin the conversation by sharing some responses that we received from food resource providers from around the state. If you've joined us for previous sessions, you'll remember that we asked pantry providers across West Virginia for their thoughts on session topics. For this session, we asked them the following questions. Have you ever had a local municipality or local policymaker dedicate local funding to address food insecurity, access to healthy food? Have they visited your pantry or your workplace? What about a legislator? In your years of experience, how many politicians, local and state, have supported your work? Here are some of the responses we received. No state or federal officials has visited our pantry in the 12 years I've been involved there. We are not located in a municipality, so no funds there. The Kanawha County Commission hasn't given us funding either. Many other food pantries in the Kanawha Valley that receive COVID funds, but we were left out. Yes, we have had several political persons visit our site and several legislators also visit. Some on Pantry Day with offers of assistance. Several local businesses have made small donations. Senator Baldwin has visited our program. The county commission gave us $2,000 early in the pandemic and gave us almost $100,000 to update the new Children Advocacy Center and food pantry. 2 of the 3 visited the food pantry. We have very close ties to the prosecuting attorney and local law enforcement. We have a mobile food pantry 2 times a month. We will be expanding our food pantry, so with freezers and refrigerators and opening daily. Well, that's great news. Kelly, many have visited, been present upon our hearing about our Food for Angels program and always agreed that it was a successful program and needed, but none have supported it. And then finally, they come around on election years, but I won't go into that. And so we're seeing varying degrees of interest, but little mention around responsive policies. So knowing this, I'm very interested to get started on today's discussion. Let's meet our panelists in alphabetical order. Caity Coyne is a reporter for Think Kids and the Charleston Charleston Gazette Mail. Delegate Riley Keaton is in District 11 of the West Virginia House of Delegates. Delegate Chad Lovejoy is in District 17 of the West Virginia House of Delegates, and unfortunately, Delegate Kayla Young was unable to join us today. So welcome all of you. Let's get started. So let's start with some context. How would you describe food insecurity in your district?
Chad, you want to take that first?
Sure. Thank you, Kelly. Thanks for letting us participate. Thanks for the question. So my area is part of Cabell, part of Wayne County. And so I think some think because we have metropolitan portion in Cabell with Huntington, that we might be in a better situation than some of the other places, certainly with food options. But the truth is that it's just as much a problem here as elsewhere around the state. I tend to use one of 2 sources when I look at raw data. Feeding America, and you can go to their website, very good. But the last data there is 2017, so that's a little old. And so I've been using for the last couple of years WVU Food Justice Lab operates a website called WV Food Link, and it has data up through 2021. And what you see when you look at that is very similar to the statewide trends. We've got about 1 in 5 of our kids are would meet the definition of food insecure. And so I think it's very real in my area, and it's something that we're fortunate to have a lot of people and organizations working towards, but the problem is still a lot more to do.
Yeah, I want to echo a lot of what Chad said about the various sources of data and that sort of thing, and also talk a little bit more from a rural context representing Roane and southern Jackson County. My mother works with communities and schools in Calhoun County also, so we've sort of got this little middle part of the state where there's a long legacy of economic desperation and things like that you end up with two big gaps that are sort of run to the fire, do something about it right now sort of problems. And those are the kids when they're outside of school, right? Outside of school time, reaching kids who are hungry, particularly summer vacation, but also during like the little breaks throughout the year and that sort of thing. And then also seniors food insecurity, that we have a lot of shut-ins, folks who have limited ability to travel to town. A lot of our kind of supply chain of food is kind of confined to Spencer in many ways. If you wanted to get the vast majority of anything close to like a supermarket experience, the only option is Walmart and Spencer, and Cash Save are also in Spencer, and they're about 3 minutes apart from each other. Whereas the Roane County's population is about 14,000 people right in there, and the population of Spencer is 2,000. So we've got just a large majority of our county that has a pretty substantial need for transportation in order to access food in a supermarket sort of setting or a farmer's market sort of setting. So those are sort of the big gaps in services, the big gaps in where people can find food. So I hope that answers the question adequately, Kelly. And that's how I sort of look at the issue from the perception of my district.
Thanks. Caity, do you want to share a little bit about your work and what you've seen?
Yeah, so I obviously, I don't have a district, but my first 2 years, I think, as at Mail, I covered Southern West Virginia pretty extensively. So I covered Mingo, Wyoming, Boone, Lincoln, Logan, McDowell. And what you see in those areas is a lot of what Delegates Lovejoy and Keaton just discussed. A lot of the larger issues go back to supply chain issues. I mean, we don't have grocery stores in those areas. So if the ones that do exist have to pay more to get food in, that means less fresh food. It takes longer to get deliveries in sometimes. So there's not vegetables or fresh food available at grocery stores for people to get. You have Dollar Generals and small stores filling the gaps in places with frozen food and non-perishables. But I mean, we know that's not as nutritious as it can be, and as we're lucky to have in some more metropolitan areas. The other big thing, Riley talked about this, but senior feeding. You have a lot of people that are confined to homes for different reasons. They might be sick. They just aren't able to get out. They might not have cars. So a large thing that I've seen pantries struggle with down there has been how to get food out of a bank or out of a pantry and into a home. Whether that's a home with children, whether that's a home with older people, it doesn't really matter. They're all in the same area, and they lack the same resources to get there. So, you have these places figuring out, how do we keep food longer? We need to get refrigerators. I thought one of the pantries spoke to that in their response. We need freezer units. And then we need, in order to get this food places and keep it fresh, we need refrigerated trucks. So every time that you need something, it feels like there's something else that's missing then to fill that gap and fill that need. And the obvious thing, we're an impoverished state, and the coal fields are the most impoverished of the state. I think it's pretty fair to say. So what we have resources for in certain points of Kanawha and Charleston and the larger cities, we don't have in Eastern Kanawha. We don't have much less in McDowell County, you know, which you have in Welch. If you go 15 miles outside of Welch, it doesn't exist. And it's a hard 15 miles to travel. It's not, you know, freeway and you go, it's 15 miles, it takes 45 minutes sometimes. And it's a really big issue, and it impacts the health of these kids and their families every day. I mean, I've met kids who couldn't describe vegetables to me in certain points. They didn't know what certain types of plants were and certain vegetables were. And I talked to a lot of organizers down there who say that kids think that their food comes directly from a grocery store. They don't understand that there's this whole process before it gets there. And there have been a lot of efforts to undo that and educate these kids and get them interested in farming their own food and the options for that. So I think there's a lot of progress that is being made, but you know, it's not as quick as some would like.
That's a great point. Yeah, a lot of great points. Do you know or work with any community stakeholders who advocate for policies or programs on the community level? So it sounds to me as if, you know, what we just discussed was there seems to be almost an interstate. We've discussed this before during the series of federal and state, you know, kind of pipelines to make sure the food gets somewhere. But then when it hits kind of that more rural area is where we see a real breakdown in the ability to get food, healthy food in particular, to people. So do you know people, or have you worked with people in this space who are doing the work?
I'll go first on that. I mean, again, we're blessed in the Huntington area. We have Facing Hunger, you know, the food bank is located here physically, the headquarters. We have about, I think, 6 farmers markets that operate. We've got 8 locally owned grocers. And we have probably some of the best school food service people that I know was Rhonda McCoy, now Travis Austin. And so, you know, we have a lot of people coming at it from different directions. We have an organization called Families Leading Change. Jenny Anderson is in that, and some of you may know her. She is the person that came to me in 2017 and said, hey, you need to read about this shared table initiative. And we got that passed in 2018. She's the one that said, this initiative should go towards senior centers, and we got that passed the next year. And she's the one for the last 3 years from the community who's been pushing for the Emergency School Food Act, which passed this year. And so there are some amazing people working within the space, both as their profession and also just as really involved, engaged community members who are seeing the problem and most importantly, doing something about it, engaging or interfacing with state, local, and even federal government. So, I know we're going to talk more about that, but I think that's part of the key to trying to tackle these problems is engagement with the local community.
Yeah, once again, I got to echo a lot of what Chan has to say. We've got some rock stars in Roane County that are predominantly volunteer, right? That Annie Hedges and Julie Greathouse and their work at Helping Hand, Food Pantry, the work that the Holy Redeemer Catholic Church does on emergency care and also supporting our pantry programs. More of the professional side are things like our Committee on Aging, Meals on Wheels, those sorts of things. But the part that I've been really interested in working on since I took office has been funny that I've known the guy since I was in like kindergarten or something like that. We've got a young man, Aaron Simon, who is working on developing like kind of full service meat processing locally. And his objective is to sort of be able to raise the animal, process the animal, and have it ready for store shelves all within Roane County. And there's so much goodness and so much effort and energy that has gotten us to this point in addressing the problem from kind of the nonprofit, more volunteer sector and these sorts of things. But also at the community level, trying to engage folks that are looking to find sustainable business solutions to these problems is something that I've sort of investigated a lot. when it comes to my district. And that's been very, very encouraging to me, the idea of being able to sort of fix some of these supply chain problems and more easily connect raw materials, livestock, that sort of thing with grocery stores and making that work. So that's been a lot of my emphasis in the district.
Thanks, Delegate. Caity, do you want to hop in? Go next question.
You want me to comment on this one?
Do you have a comment to share?
Okay. Yeah, I think there's a lot of people out there that are doing a ton of work, just too much that we can fathom. And a lot of it we don't even know about. There are neighbors that go and get food for their neighbors. They organize community drives because they know that they have some homebound neighbors that can't get out. They do the same thing for water accessibility. In McDowell County, you have the McKinneys who run the 5 Loaves and 2 Fishes food bank. It's probably at this point, one of the most famous food banks or food pantries in the state, and they get national attention all the time. But what I talk to a lot with these folks is they all have their own efforts and they're all working, mostly volunteers, a lot of older volunteers. And sometimes they overlap in what they're offering in a way that maybe they're in an area that they could use the same resources and then reach more people, but there's just no infrastructure in place to get that work done together. You have people that have their own ideas and they start doing them and then not knowing that something similar exists that they could have just expanded on into different areas. So you have a lot of people that are really passionate about doing this work and oftentimes doing it, for free. They're not making money off of it. And most of this is led, at least in my experience, in a lot of places, by really dynamic community figures, the ones that lead the change themselves. And they go out and they recruit volunteers and they get people to come every Sunday and help organize and sort and then deliver out of their own pocket for gas and everything else. And then, sometimes it becomes impossible for them to do anymore. And the infrastructure doesn't exist to pass those resources on to other people in the community to operate. So you have things that exist for a long time really well that people get used to. And then, God forbid, someone dies. Someone gets really sick. They can't take the workload anymore. And those resources disappear. And people don't know about it because it's not as interconnected as it's not as easy as just checking Facebook and seeing what happened. It's sort of a whisper network of, to go here for food on this day and there for food on this day and there for food on that day. Well, what happens if your Wednesday resource disappears and you don't have food for your kids for the weekend? We don't have any resources at the state level right now to organize for that.
That is such an important point, and it leads well into our next question because we have so many of these amazing people across the state, and they are propping up this kind of makeshift infrastructure. And it's not propped up by policy, it's propped up by people. But a lot of these people are older, and they've taken a lot of this work on upon themselves. And then what happens when something happens and they go? So I think that we really kind of learned that lesson during COVID when many of our volunteers, because they were older, really had to stop volunteering for a while because it wasn't safe for them. So for the past 3 years now of the Health and Hunger Project, we've seen a strange juxtaposition emerge where many of the recommendations that our panelists offer are very local focused. So they believe better connections between healthcare, access to healthy foods should happen on the local level. So that's where they think that real policy, real change should come. More communities should have collective conduits is what we've been calling it, that connect and centralize local resources. So like when Caity says one group doesn't know when the other is doing and they kind of duplicate efforts. So to making sure that we stop that, and then we try to better collectively address the transportation problems. But most of the funding and policies that address food insecurity and access to nutritious food happen at the federal level. How do we negotiate this?
Well, I'll jump in. On the federal level, you're right. I mean, a lot of those USDA programs, if you get into, they have a bunch of acronyms, but there's like TFAP and all these different long words of letters. And it's true, there's only so much you can do in terms of changing federal policy. I've done a lot of work with Emma Bryan. She's with Senator Manchin's office, and her task is to handle, food insecurity, the federal. But Frankly, I think the answer is probably, or at least to me, seems more on the state level in terms of organization. Now, the federal policy is the federal policy, and we can advocate to change and improve that. But the issue of coordinating efforts of food pantries in Roane County is unlikely to come from Washington, D.C. One of the things we are, part of the speaker's food insecurity work group, we went around and talked to many, many people around the state coming at this space from different places. And one of the things, if I were to say takeaways, was we have many, many wonderful people and organizations working in silos. So you're doing great work in Kanawha County, but you don't know that 2 towns over, somebody's trying to reinvent your wheel. And so we said, we could really eliminate some redundancy, some inefficiencies, and most importantly, increase the quality of service, getting the right food to the right people at the right time, if someone was kind of doing an overwatch of this. So I went to the West Virginia Food Justice Lab and talked with Dr. Lonez up there and said, what can we do? And he looked around the country, and there is in some states, and maybe one, a statewide office of food security. And so we put together a bill. I mean, he did mostly, and it was introduced last year as House Bill 4702. And the idea is to create an office within the governor's office. And their job is to do just that. It's to coordinate with, and there also are 55 county coordinators. And so those, let's call it 56 people, are getting the information from Calhoun County to the mothership, and everybody's working together. And my thought was the cost of the office might even be made up in reduced inefficiencies when you can fix some of those. So I think that is the only way. If we just keep doing good work in different places and don't talk to each other, we're doing great work, but it's not as efficient and as effective as it could be.
Great point.
Yeah, and I think even sort of beyond the coordination part that is necessary, that would be good, that would be fruitful. I think that there are some things that I've observed in my own community that are sort of the fires that state policy needs to run to. So those are things like the number one that comes up all the time is aging volunteer base that ends up limiting hours of service, that ends up changing even sometimes the kinds of foods that can be served on what days, of like, oh, that's the day of the heavy truck, like that, things like that ends up really shaping a lot of delivery. And during the most recent special session of the legislature, we passed Senate Bill 2009 that expands the Learn Everywhere program in the state, that essentially says that if students in West Virginia public schools can build sort of an extracurricular experience for themselves, right? It's supposed to be kind of freewheeling. That's the goal of it, right? Is more flexibility and do something that is academically beneficial, and they should be able to earn credit for it. So I think an additional role for this, for anything like an Office of Food Security, or if it's on the nonprofit side, just responsible for connecting people with these sorts of information, is to connect these kids that can do things for academic credit to service in food pantries and to helping kind of rebuild this base of volunteers that we are going to have a problem with over the next decade in order to sustain these levels of service. So I think in terms of state policy, we should also run toward some of the fires of things like shrinking volunteer bases and the impacts on services that come from that.
Yeah, I think there's a lot of overlap with the issues of food security with other issues in the state. You talk about aging volunteer base. We see the same thing with water systems. All the people that operate our water systems tend to be older. See the same thing with homelessness services. A lot of our volunteers tend to be older. So we have all these issues that I think are pretty well documented, even if we don't have necessarily data for them. And for me, my belief, on a theme for all of this is most of that funding for these issues, whether it be water systems or drug addiction or homelessness, come from the federal government. Same with food insecurity. All that money usually comes from the federal government, but we know that the federal government can't solve our issues for us. We know that we need to give the tools to localities and to local policymakers and local advocates to solve their own issues and point out where the holes are. People in different counties, people in MacDowell, they have representatives at the Capitol, but they don't necessarily like prescriptions for their issues coming from Kanawha County, from Charleston. They know the issues better than anyone. So I think the really important part there is the state should be Delegate Lovejoy talked about the state office for food insecurity. That's great. And I think in a perfect world for these people, the way that would operate is the state coordinating and putting eyes on these programs and doing all that work to say, here's the network that we have and where all these strings go. But all of those resources should be handed down to the localities to make their own decisions of what to fund and what not to fund and who to support and how to put it together. They just don't have the resources to make that playbook of recognizing what's overlapping and what's not, or what efforts are going on in other places. It really does operate in silos. I think that's a great way to put it. And in order to break down those silos, we need the state to organize. But again, I think the change has to be self-made, and we have to allow people to have their own autonomy over making the change that they need. And some of the things, we might not understand that it's an issue. We might not even flag it as an issue because we don't have that issue in Charleston or in Huntington or somewhere else. But we need to trust people to know what their people need. And I think that's a universal thing, but specifically with food insecurity, people know their communities. People in communities know communities better than us 100 miles away, 200 miles away.
That's a really important point. That's something that we've discussed. We discussed it last year pretty in depth. And, we had a number of people, panelists, who said, we really, they kind of balked at the notion of somebody, like if this were a person at DHHR, for example, they were afraid of the bureaucracy, the politics of it, that there would now be a very prescriptive process that would need to be followed in order to address issues that they know in a way that this person is never going to know. And yet, if we're especially talking about state funding, there has to be some sort of oversight and accountability of it, right? So somebody has to be ensuring that money is being spent appropriately. And Delegate Keaton, to something that you were saying in session 2, we talked about the need to more systematically engage young people, whether it be creating a statewide network or maybe, a pilot in some counties, because not only do we need more young people helping the older generations who are fulfilling this volunteer work, but we also have a problem of many of our, for lack of a better term, at-risk kids around the state that don't feel engaged. They don't have this sense of community. And this is a really good way of helping them understand that they're bigger of a part of a larger group. If we think of somebody at the state level who's looking at food insecurity, at the same time, somebody who may be working on something with drug control policy, then you may be able to really create a great program to target foster care youth, kids in the system, to ensure that they have volunteer opportunities that could look good if they're moving on to higher education, but it also gives them that really important sense of community. So
if I may, Kelly, too, I also think that it's helpful if these things take the statutory and legislative form of kind of arming public school districts with things like that too. That's not entirely. I agree with you that having sort of like the Office of Drug Control Policy and these folks at the state level playing a supportive role but also empowering local school districts to start to offer a lot more of these things, like for credit. Making sure that like their guidance counselors build it into the schedules, because there are so many things that we enact in Charleston that sort of we know who handles a WVDE, for example, but like when a kid goes into scheduled classes, it just doesn't get brought up. You get what I mean? That from my experience, just a very minor thing. I desperately wanted to take economics in high school, and I knew that it was in the course catalog, but like, Riley, you're the only kid at Roane County High School who wants to take economics. Okay, so we can do a lot at the state level, but it needs to have like a local first implementation strategy for implementation.
Completely agree. And we'll get to it in a little bit, but it's amazing how often when we talk about these things, we go back to partnerships with the local school system. They carry such, there's such a backbone there of addressing food insecurity for the pediatric population. So I do want to pivot because we do have folks who are really in the know to answer this question. Over the past few years, what policies have been introduced at the state level to address food insecurity in West Virginia?
Chad, you want to talk about emergency school food?
Yeah, so probably before 2017, kind of the biggest policy change was in 2013 when the Feed to Achieve Act passed, which dealt a lot with, school kids. And then in about 17, we started a hunger caucus in the House. And it was kind of an informal thing. It was bipartisan, and it got together several times and kind of talked policy. And that led to some bills starting to be introduced in 17, 18. And then that kind of formalized, last year with the speaker appointing a formal work group with, a staff to help. And so we were able to kind of put more into, a formal program. But just looking back at some of the bills that have been introduced, and I'll start with the ones that have passed. And I think I mentioned earlier, the Shared Table Initiative for schools, for senior centers, and the Emergency School Feeding Act, or Food Act, which was passed this year. We also this year passed the Farm to Food Bank tax credit increase. And interestingly, I spoke with the Huntington City Mission, and they had 2 cows delivered to the meat processor through that program this morning that will go for ground beef. They serve over 200,000 meals a year in the community feeding program. And so that is a direct result of some of that legislation. We've had bills that haven't passed, a senior farmers market nutrition program, which we have vouchers, but it hasn't been updated in like 20 years. So increasing those. A West Virginia Healthy Food Crop Block Grant Program, which was kind of an entrepreneur initiative to try to get farmers to grow some more. We've always had each year, I think since I've been there, some expanding of the Good Samaritan Food Donation Act, which was trying to get stores to donate some of the leftover food. Delegate Young has introduced the last couple of years a program called a Food Infrastructure Grant Program, which would be for the infrastructure, the freezers, fridges, shelves, that kind of stuff. She also introduced a Food Desert Produce Pilot Program and a Hunger-Free Campus Act that is targeted towards our college and community colleges and universities. There's also a Food Waste Task Force bill and a Right to Food amendment, which is interesting, which was actually a constitutional amendment. It's been introduced 2 years. And so those are, at least in the last 4 or 5 years, the initiatives that have been introduced and the ones that I can remember that have been passed.
Yeah, Kelly, if I can also chime in a little bit on some executive action too, that Delegate Lovejoy and Delegate Pack really, Delegate Larry Pack and Chad were both the sort of co-chairs on the hunger working group within the House, and they did a lot of really excellent work talking with the governor's office, so that to make sure that this issue was a top priority when the final allocations of CARES Act money were made. And that $7.2 million allocation from existing CARES Act funds from the governor was sort of responsive to a lot of those conversations that the food working group, the food insecurity working group, had as part of their mandate from the speaker, that they were things like, we were hearing about all of these really large capital expenditures that were necessary, things like the refrigerated trucks and all of these sorts of things that largest food banks in the state, and to some National Guard resources. This CARES Act funding helped take care of a lot of those things. I'm sorry if I'm a little bit distracted, guys. We're still running a summer camp right now, so I have some counselors rolling in and asking where the bleach is. So if I'm about half distracted, that's why. So I apologize. But yeah, I wanted to emphasize Delegate Lovejoy and Delegate Pack's work on the CARES Act funding from the governor's office.
I'll throw one more thing on that, Kelly.
Yeah.
Absolutely. Governor Justice has been a real friend to folks working in this area of food insecurity. He's the first governor to have put the food banks as line items in the budget ever. And then like my friend said there, that CARES money, and I kind of had a breakdown. We frankly had looked for about $3 million, and that was a wish to try to get $1 million, right? And so the idea was to try to get some money to the food banks. They have a shared facility at the Rock Branch National Guard facility in Nitro, and it needed some new, commercial refrigeration for cold storage, and both food banks use that facility. So we thought, hey, if you upgrade that, it helps both of the banks. And then both banks individually had some capital expansion. And then finally, additionally, getting some money back to those food rescue missions that got hit pretty hard during COVID. On top of all that, the governor said, well, I'd like to get some money to the individual pantries. So we got a list through the food banks of, it was about 600 pantries that are, I won't say registered, it's not like a registry, but they are vetted and on the list to participate in these federal and state programs through the food banks. And the governor apportioned $5,000 to each one, okay, which, that's $3 million, so that each one could, maybe it is buy a new shelf, maybe it is, buy a new refrigerator or tables, but it was an infrastructure. It wasn't limited to that, but many of the ones I spoke to said, this is what we need. We need to go buy a new refrigerator or freezer. And so I just, the governor, again, this is a bipartisan thing, but as a Democrat with a Republican governor, he has been over backwards. Every time we've asked for something in food insecurity, he has been there, and I give him a great deal of credit, as to my co-chair, Delegate Pack, and Delegate Keaton. I mean, he's on the group too, and we got a bunch of people that kind of took some interest in it, and it's been one of the highlights of my time in political office, because people are working together and getting stuff done.
I think those are great rundowns of what the state has done and what you guys have done, which is really impressive after, going back through bills introduced in the legislature before 2016, 2015. There weren't a lot of hunger bills. There weren't a lot of food security bills. One thing that I would, add too is there have been efforts or successful ploys to also at the state legislature in recent years to increase barriers to food accessibility. And I know that's something that food advocates and hunger advocates would really, really like the state legislature to look at. The one that comes to mind, obviously, is the drug screening for SNAP benefits, or TANF benefits. It's I think people probably know where I stand and what I write about drug addiction and all these things. But we can't ignore that there's a large overlap of people who are struggling with poverty who use drugs, and people who are struggling with poverty who struggle with hunger. Benefits like that criminalize, or not benefits, programs like that criminalize and stigmatize people who need food and are hungry, they actually hurt the most vulnerable in our populations. They hurt our children, they hurt our seniors, people who are relying on others to take care of them. That's something that I know food advocates would really like the state legislature to look at, to consider, and really take to heart that the people you're trying to target, A, in my opinion, don't deserve it, but B, those aren't the ones that are being harmed by this. There are other people that are being harmed, and we, I don't think, have done a great job of taking that into consideration as we look at legislation like that. And I hope in the future we can see more mind given to those people and more care given to.
Thanks, Caity. And that's a good segue, because I think that's one of a number of issues that comes up at the legislature, where I know personally, as you do, that there are people who are opposed to it, but you don't really see kind of a public discourse around the pros and cons of why, for or against testing people for TANF dollars. And so what suggestions do any of you have for stakeholders who want to see policy change on a local level, on a state level, but don't know how to engage with local government or state government?
Well, I think you start, with your representative. Frankly, people listen more to constituents. We do get, information, and people reach out from all over the state. But, when you are their representative, I think that helps. So getting to know who your representatives are, and having a dialogue, I think is critical. I also think it was helpful, and I remember when we were doing work requirements, you're right on these barriers, and one of the things that was very, to me, I was getting a lot of these pantries reaching out and saying, look, we did a pilot program in Cabell with these work requirements, and it was very clear that once they went in, people didn't stop eating, they just started going to the pantries. And so we had all these churches coming in saying, look, here's our numbers, here's our graph, here's our community feeding program. And everybody had this big spike. And you say, what happened right here? That's when this pilot program went into effect. And so, we were able to have real data-driven discussions about how these things impact people. But it was because, it wasn't some abstract battle of philosophy. It was because people in the community were coming and talking to their representatives and saying, hey, I'm with the XYZ church pantry, and this is crippling us because of this and that. So I think that engagement's important. And then I think also finding every legislator has different, I won't say different issues that kind of they lean into. And so finding the people that are working in that space for you is helpful. I mean, much of our current work group won't be coming back next year. Before that, we lost over half of the hunger caucus, that was there in the beginning. And so there will always be, new people involved, but for citizens to stay engaged, I think that's going to be, this problem will not change, even though the names and faces of folks dealing with it will. So you've got to reach out and have those discussions with your legislators.
Yeah, everything that Chad said is exactly right. And I think that if you're somebody in the audience that has more of like maybe a statewide presence, the best way to talk with legislators is just sort of identify somebody who has common cause with you that is in the district of a specific legislator. And then kind of the next part of that, and it follows plainly from what Chad's talking about, is that come see them, right? It's much easier, especially if it's the legislative session, to come to Charleston and get a meeting. That's about 1 million times more memorable and impactful for your median delegate than being voicemail number 30 out of 50 on the office phone when you come back from floor session, right? So if you can be present, talk with folks, make your points clear to them, and exactly what Delegate Lovejoy was talking about on education, that there's going to be some pretty substantial turnover in the new legislature, that we're going to have a lot of new faces. There are things that we've heard 1 million times before on every part of this issue, right? There are things that anybody who's been kind of in the space and working on this sort of thing is well versed in. But for a lot of these folks that are coming in, it'll be the first time they're hearing it. It will be the very first time that some of these folks have heard it. So much like running a campaign, be ready to have the same conversation. Thankfully, here it's just about 80 to 90 times as opposed to 1,000 times, but be ready to introduce the issue, make the point, have a clear ask, that sort of thing, and just engage with your legislator.
I think all of those, obviously, these are the people that you are bringing these concerns to. One thing that I've heard people have luck with too is, if you know an issue is important, specifically hunger, study your legislators, see what they're voting on, see what they're speaking about on the floor and what appeals to them. And then, food is such a big issue that connects to everything. So if they're big in education, tie it to education. If they're concerned about health, it's a really obvious tie. If you don't have fresh food and you're hungry, you're not healthy. So find out what issues your legislators are working on, whether that's locally at the county commission level or up at the state level, and find a way to tie whatever specific thing you're asking for or looking for to that. Hey, if you do this, we could have this many more healthy kids. Our test rates could go up like this because right now X% are hungry. And if they weren't, they'd be able to focus so much better. Child protective, anything, every legislator I know cares about our kids deeply. I don't think there's anyone out there, whether they disagree or agree on different policies, is wishing harm on children. Work that to your advantage. That's find out what specifically they're looking at and say, this is how hunger affects this, but you could do this and it could fix something. And I think other things, strength in numbers is always good, and be persistent. So if you know that someone else in your county is working on something, or even in the region, talk about a game plan for how you're going to go up to the legislature and talk to them. If you can't make it to the legislature, which unfortunately is a reality for a lot of people in our state, just can't take off work, can't make the drive, can't do those things. See if you can connect with advocates and other people who are able to go and tell them, hey, this is something we really need, but we can't afford to get there. We can't afford whatever the cost is to get there, and group those topics together so they know that it's not just, a small group of people asking for this, or one person asking for something to affect a small group of people, but something that would make real change county and district wide. I think that's always good. And yeah, like I said, be persistent. Might not get a response the first time, the second time, the third time. 6th or 7th might work. Someone else asking and mentioning you might work. Once they know your name, it's harder to ignore you. So that's always, keep your name up there, keep your issue there.
These are all such important points. The point of having to reiterate because you have turnover on the local and state level is so important. So you have to keep beating your drum every time. And I think, I've seen such a change in the nonprofit sector in advocacy work. Years ago, we would be animated in saying, during the downtime is when you want, a legislator or, county commissioner to come and visit your pantry and get them to know how many people you serve and what the issues are. And now it's a lot of, you get an action alert in an email and you push send because it pops up who your legislators are. And that's such a kind of, not only is it less communication, but they're not going to know who you are from an email. But they will know if you're in front of them in person or if you show them where you work. And so it takes, it takes much more intentional effort to build those relationships with policymakers. We've been touching on the importance of social capital. Do you have any ideas on how to help build social capital, to push the needle on some of these things, to make our priorities policymakers' priorities?
I'll say one area that I've been kind of pleasantly surprised at, a new area, is that of healthcare. The insurance companies, hospitals, the medical associations, are getting more into this pharmacy with an F space. And, I'm sure that there is also an economic aspect to it, that when you do preventative medicine through more nutrition, there is a savings. But I know here in Huntington, our Mountain Health Network has a whole initiative called Food is Medicine. They put some money into our Huntington's Kitchen, which is a community food center. They teach you how to cook. That's a pretty cool place. They have a pharmacy program at our cancer center. They have, with our dialysis center, medically indicated food box program. So low sodium diets. St. Mary's has a food box, and I'm sure the Palatine Foundation is probably a large part of many of these programs. They have a nutrition education. They have several food pantries, and then they also support financially groups like Marshall has a nutrition education program. And so the medical community is getting involved, and that can be a game changer. I mean, getting those foods to say you have people with hypertension, uncontrolled hypertension, and so getting them the right diets will reduce readmissions. It will prolong quality and quantity of life, and so those are big players, and I'm thrilled that they're involved here. I think they're moving now into Mingo County with the next level, and so hopefully that program will continue to take off.
Yeah, I think everything Delegate Lovejoy is talking about with the healthcare community, and this is much more practical legislative way of looking at it, is that your chairman of your House Committee on Health is a doctor, your chairman of your Senate Committee on Health is a doctor, and your Senate Majority Leader is a doctor. So organizing among essentially their quasi-professional social circles is very helpful to do. And then beyond that, particularly working with these two majorities, I think is faith-based coalitions, and talking with some of it's easiest to go for the larger, more organized denominations, right? Like I work for the Catholic Church, the Diocese of Wheeling, Charleston, and you can pretty well get a hold of the head of Catholic Charities and know that you're talking to the whole state's Catholic Charities. But in places like a ton of unnetworked independent churches, right? That if those folks get keyed in on how much it matters that we need policy to feed kids, that is going to make a huge, huge difference with your average member of the West Virginia House of Delegates if they hear from some of those folks. So in addition to the healthcare community, the medical community, I think there's a lot that could be done in building influence by faith-based partnerships.
Yeah, and I think those are all already really big players in the game, so that's great. It's funny that you asked that question, Kelly. I was prepping last night, and there were like so many studies that show that social capital and increased social capital in communities actually lessens food insecurity, which is really interesting. And when I think of social capital is one of those like words like synergy, kind of like what does it mean? And when I think of that, I think what Delegates Lovejoy and Keaton just shared are excellent examples. And I will come to this as a journalist. I think storytelling is a really powerful tool in building that capital. If you, and not necessarily in a newspaper or in a TV station or in journalism, but if you're willing to share your story and say like, hey, we're working on this, and I know not a lot of nonprofits have really embraced this, where they are hiring people to do storytelling for their organizations and show the impact of different efforts going on, but also the challenges faced by those communities. So if you can find a way to open up and share those stories, you're going to find, I guarantee, at least 10 other people in your community that are struggling with the same thing or that want the same thing. And I think, I've seen success with that in the water access realm, where people have gotten together and done storytelling of what it's like to not have fresh water. And then they start a fundraiser and they get all this money in and they're able to construct these water lines. That's magical. That's amazing. And I think there's similar things that can be done for food insecurity. And again, you know, I do think that the state has a responsibility to help. I think the federal government has a responsibility to help, but those are efforts that I think can help us get there. Help them see this is how wide and the breadth of this issue. Here's how it's affecting us. Don't you care? Who's going to say no? I don't think people are ever going to say they don't care.
Great points. I would say storytelling plays a big role, particularly when we sometimes struggle with data. Like Chad said when we started this conversation, that we're lacking in data from 2017 on as to how COVID has really affected hunger, food insecurity. But I think that if we could get more stories from the witnesses, and so I mean those people working in the pantries, working in healthcare, who can say, healthy eating has really improved the lives of people that I work with. It's really improved the lives of the people. The work that we do has improved the lives of the people in our church. I think that these would be really important folks that we need to build that social capital with, because sometimes when we start talking about getting healthcare to the table, we immediately think, who's the government relations person with WVU Medicine or Marshall? When we really want to look at all those people who are doing that local work one-on-one with the people who need help. And lastly, before I go to the next question, I wish we could find a way to harness the power of the faith-based community in the state, because they do so much of addressing social determinants of health in our communities. So they're doing a lot for kids affected by the drug crisis, and they're doing a lot to address food insecurity. And they would be an incredible, powerful force at the legislature if they, galvanize their efforts. So having said that, let's move on to this question. What ideas have crossed your desk or landed in your emails that sound like good ideas to tackle on the community level to address access to healthy foods for all? So what have you heard that didn't go anywhere?
Well, the number one kind of barrier that I, kept hearing about was the transportation issue. And so we're having, that was what I've tried to do is think of how can we, if we can't get people to the food, how do we get food to the people? And so, it was something like on a list. I mean, it was, if you took a pie chart, it was like over 50%. The rest of the barriers were less than that one. And so, I have thought about, those mobile food pantries. We're seeing some of that in Huntington at our Wild Ramp. It has an outfitted vehicle that goes to different neighborhoods, and the neighborhoods know which day they're there. So like on Tuesdays, you're here, and Wednesdays you're here. And so there is this kind of reliance that it's going to be there on this day. And through programs like Snap Stretch, which is just amazing, and you can, take a SNAP and multiply it threefold in some instances, you're getting to a situation where you can get a whole lot of very good nutritious food. So some way to, everything from funding them to using the school bus system. And we saw that in COVID. I mean, you have bus routes and the buses go places, but using some existing infrastructure to reduce the barrier of transportation access seems to be, maybe it's more of a problem than an idea, but those are the ones that I have tried to pay the most attention to. I just don't know from a legislative perspective, other than a funding or an allocation, how you legislate that. But that to me is what we've got to tackle big time.
Yeah, I was really encouraged that he wasn't going to steal my thunder until he got to the school bus section. That the school bus system, I think, is really, really powerful, and it's something that, just if you imagine that you were a space alien who came down from their spaceship and you learned about the school system, one of the most fascinating things about this world that we've chosen to build is that we have these giant vehicles that go everywhere in a county every day, right? That is just a logistical wonder. And the more that we can support sort of this community and school district collaboration on the issue of food insecurity, and plugging in things like in my hometown, Helping Hand Food Pantry with Roane County schools, and sort of formalizing, and I don't know if it takes statutory change, but providing some sort of formalization of those relationships so that you're plugging private sector food into public sector distribution, I think could be a huge strength of ours, because you can still leverage all of the private capacity that comes with raising money, with gathering donations, ease of administration, these sorts of things, that if they can slot into public distribution channels, I think that's just immeasurably powerful.
Yeah, I think a lot of not so much options that have been brought to me, but what I've witnessed, and one thing I'd like to see efforts on, and I don't think that there's a way that you could legislate this, but it would have to be, community-based change, destigmatizing access to food, destigmatizing needing food. Here in Kanawha County, I think Covenant House does an excellent job with their pantry. You walk in and it's like a grocery store. You take a basket, you walk through, you get what you need, and at the end, you check out the same that you would. Aside from checking out, you give the paperwork, whatever you have that you need that got you to the pantry that day. I think that would go really far. And I know at the beginning of the pandemic, I talked to a lot of people who were using pantries for the first time, who are food insecure for the first time, and not even getting to the point of they didn't know how to navigate the services, but they were afraid to ask about them. They were afraid that people would judge them for needing them. So I think we could really see a change if we normalize and we really impress that, you are one of 300,000 people that need this in our state. There are so many people that are hungry in the state, and you're getting the help that you need. There's no shame in that. But separate from that, I think food waste is a big one. I know other states, California has done a really good job of changing their college campuses to zero food waste. So anything that's left over in cafeterias at the end of the day is recycled and then given to shelters, pantries, etc., with a certain use by date, because it's cooked usually. But I think there's a lot of ways that we could explore and get our colleges involved. We have a lot of colleges in West Virginia. It's kind of wild to me coming from California, where we have a whole UC system, but we have so many colleges here that I think are really willing to be involved. And a lot of them have their own networks that are student-led, the food security networks, things like that are working on waste issues and some specifically tied to climate change and stuff like that. But I think we could involve them in this process a lot, and we would be amazed by the ideas that they have and the success that they've had that we might not even know about.
Great point. I think there was a group that I think they worked with Delegate Lovejoy last year to address food insecurity on the higher ed level. And it would be great. I know that you see a lot of them doing it individually, but if they united their force again, build that social capital, I think that they would be able to elevate food insecurity, addressing it as a priority. So I'm going to pivot again to a kind of loaded question. We've talked about bringing issues to the local level. How do we get better at making rural health issues like food deserts, lack of access to healthcare, et cetera, a federal issue? How do we build our social capital?
You want that, Riley?
Sure. Well, I mean, West Virginia, honestly, for at least the next several months, we are maybe better positioned than any other group of people in the entire country to get what we want in DC, because Joe Manchin is the swing vote, right? He gets to veto bills, essentially. So if that is where I would fix a lot of my organizing, and Senator Manchin makes himself very available, makes his office very available to folks, that there are these regular, sometimes they're themed around veterans assistance, various just constituent affairs, almost workshop sort of things that all of your legislators are invited to. Most of the time they're virtual, there are in-person components to it, but there are opportunities for your state legislator to build relationships with with Senator Manchin's office. And I think encouraging your legislators to try to advocate for you as it pertains to DC, that's a really potent thing. I might have some more thoughts here in a minute, but I think that sort of focusing your efforts on building relationships with people who have a relationship with Senator Manchin's office is one of the most, it's what every advocacy group on any issue in the entire country is trying to do right now. So, and I think that's the case because that's the right way to go.
Thanks.
There are, it's either 13 or 15 federal food and nutrition programs, and the way they are administered, and this was one of the reasons we conducted meetings this way, you got some through DHHR like SNAP, you got some through Department of Education like school lunch program, you have some through Department of Agriculture like the Farmers Market Nutrition Program. So you have all these state agencies at different ones administering different federal programs. And so one thing I would suggest, as opposed to trying to create new federal programs, which is very hard, and there's a lot of resistance, is if you're trying to take on a particular local issue, look at the existing 15 federal programs and try to pigeonhole yourself into one. So like, if you're veterans, okay, there's a veterans component in community supplemental food assistance program, CFEP, something like that. So if your particular thing is, hey, I want to increase delivery of food to my veterans or older seniors who served for us, then maybe you can try to get into that program and work within it. So I think that it may be best to work within the existing federal structure than to think it's likely that we're going to go in and create new federal structure, at least at this point.
Yeah, Caity, sorry, can I jump in? Because I remembered my second component was that the congressional earmark is back too. So when you're trying to figure out what is the most attainable thing to go after in the process, right? It's one thing to try to have statutory language included in some behemoth piece of legislation moving through Charleston. That's a very politically contentious and kind of hard to pull off thing. But the congressional earmark process is built for groups like those addressing food insecurity to come make their priorities known, and then ideally have those priorities addressed by our legislators, by our federal legislative delegation. So don't ignore the congressional earmark process. I think that's how you're going to get a lot of these priorities addressed at the federal level.
Yeah, I think Delegates Lovejoy and Keaton really, those are great. I think you really hit me in the gut with that one, Kelly, because I immediately went, I have no idea. And I feel like people smarter than me and older than me and more experienced than me have really been thinking about this for a long, long time and have tried to make efforts, not in the journalism realm, obviously, but in the advocacy realm and in the health realm in general. I don't know what's been successful and what hasn't been. I hope that we see more successes in the future. So I hate to be negative on that. I don't have a better answer.
Thanks for all of you for answering that. I think that Delegate Lovejoy really brought up something important for the last of the first 10 questions, and that is do your homework. So if this is a space in which you want to do work, find out who's already doing it and who's funding it and which federal department and how's that trickling down. I know when we at Think Kids, we every so often someone will call or email and say, why aren't you doing any more about this? And when I get those kind of responses, I'm much more apt to get more involved in a person who sends that to me, who shows me they've really put some time and effort into that work that they've done about, whatever it is that's stuck in their craw that they just think we need to work on. Because if they've got a really good idea, they've got a grasp on what the problem is. I think this is a really good partner for us because they're willing to do the work and take the time to know the challenge at hand. So the last question is, what parting advice do you have for any stakeholders or advocates who want to work in this space? Where should they start?
Education is what I'd say. I mean, learn the issues, learn, so many times if you get in and say, well, I think we should do this, somebody says that and you say, well, we already do that, or we have that, or, what I mean? So I think for me, coming to it when you show that you put in that research is helpful. I think it also helps to play on the political piece. And I'll give you an example. I was touring Facing Hunger, and we were looking at these, they were CSFP boxes. I said, all right, what are these boxes? Well, these go to our veterans. Well, that's a lot of boxes. How many are there? Well, there's 93. I said, wow, we have 93 people that are going to get this, right? And it's like a 2 weeks worth of food. And I said, wow. She said, well, it's much worse than that. We have 140 on the list. I said, do you mean there's going to be 47 veterans who don't get food? Yeah. I said, why don't they get the food? Well, we don't have any more food. Why don't we have any more food? We don't have the funding. That's the end of the program. So I reached out to Manchin's office. I said, hey, do you know there's 47 veterans that qualify for food and won't get it because we're not funding this program? And so, they take the information, and I don't know that gets it done. But the truth is, when you start thinking about, those ramifications, that's a pretty, I think, a moving issue. Likewise, when your local, say it's the director of your mission or the pastor, we're a large food pantry, when they're reaching out to you and, saying, hey, we have this issue, we're feeding this many people in the community. I mean, there's some pressure that goes with that to deliver some kind of answer. So I'm not saying be overly, I don't want to say aggressive is not the right word, but come at your legislator with not only here's a problem, I can explain it to you. I also come with solutions and specific asks. I think is what Riley said earlier, which I think is exactly right.
Yeah, I was going to reiterate the specific asks portion of this too, is that it's really easy for folks, especially on an issue that says like at least visibly widely agreed on as food insecurity, that it's really easy for a legislator to sort of like offer to wave the pom-poms for you on the issue, of like, really love that, love what you're doing, keep it up, call me if you need anything, right? Actually make the call, right? Actually make the call with what you need. And it's, a good example is a group that I sort of did a little bit of work with, and they came to me and explained their issue of needing additional storage, and like they didn't have like a cost estimate on the cabinet that they wanted, right? That just little things like that of the conversation is easiest to start with. Here's what we do. Here's why we do it. Here's where it could be better, and here's what we need to do that better. And then here's what you can do for me, right? And that sort of thing is really, really important. And then in addition to that, to always keep an eye on the relationship, right? That it's somebody that like, I get this way with my own legislation, is that it's really easy to sort of tunnel vision on like, I really want to get this thing done, right? But also once it is done or once it isn't done, like there'll be something else that I feel just as strongly about a year from now, that if these initial interactions about trying to enact policy are ordered toward building a relationship, being somebody that they'll take your call and think like, oh, this person's going to give me useful information, helpful information, it's going to be a mutually beneficial exchange, that sort of thing, then it makes it even better the second time, because it's easy to view political capital as something that only ever gets spent, right? That you're writing checks out of your reserve of political capital with your legislator. But if it's more of an investment where like you have an eye on the relationship, there's some real thank you to the folks that help in the process, that sort of thing,
it's really much more closely resembles an investment that can pay dividends as opposed to spending of political capital where you eventually get out of it. So those would be my 2 points. And I'm sorry that I have to jump before the Q&A, but we have to open the water slide. So I have to go take care of that. So thank you all so much for having me. I really appreciate it.
Thank you, Delegate.
Yeah, I'm sad he has to jump. He just made a really good point, I think, on mutually beneficial. So, the same way that legislators can help you out, you can be a resource for them. It's impossible to know everything that's going on in every part of a district, but if you can call up when something happens and tell them, hey, this is an issue that we're facing, here's some background information. Data isn't always available, but anecdotal evidence is pretty strong, I think, especially when it's widely applied to a population or community. And aside from, those two, Chad and Riley, are experts in the legislative realm. I think if you're trying to get involved and you're passionate about this issue and you're working at a community level, whether that's with city councils, county commissions, anywhere below that, recognize your own positionality on the issue. Recognize what you're an expert in and what you can offer to the efforts that already exist. And going back to what Delegate Lovejoy said earlier, don't reinvent the wheel. Don't try to come in and remake something that's working somewhere else really well. Reach out to those people and see how they did it and how you can replicate it in your own community. And then be very, very honest and realistic with yourself of the limitations. So if you, an example that we talk about a lot in journalism, specifically to reporting, but I think is pretty universal, recognize your own privilege in certain situations. So I am obviously like a white woman. If I go and I'm trying to cover a Black community, I'm never going to do it the same way, or I'm never going to be able to do it the way that someone who is Black could. I'm never going to have that same experience. And I need to recognize that myself and admit it before I try to help, or before I try to write about them in journalism, but in advocacy before I try to help them, right? Be very honest and research the efforts that are currently helping and that already exist and why, and study why they exist that way. And if a community has certain needs that you don't understand, you need to admit that you're not going to understand that and just sit there and listen. Going back to the whole, communities don't want prescriptions from people who aren't from there to solve issues that they're facing. They want to solve them themselves and they know them better than anyone. So give them that freedom, give them that ability and that autonomy to do so as a volunteer, as an organizer, or as someone that's lobbying at the legislative level, whether that's state, county, city, whatever. Center the voices of the people who are really going to be affected by this, and take a step back when you have to, and when it's appropriate.
Great point. Thank you. Sorry that Delegate Keaton had to leave us, but I'm sure the kids are very thankful that he did. I think one more point before we jump to the last 5. I think, we have a little less than 10 minutes, is, if there's a public meeting and you're wanting to sway, the discussion, whether it be your county board of ed, or, if it's county commissioner, show up to the meetings, get them to know your face, because it at least shows them that you care about what they're talking about. I think it's building that connection, and then you get a feel for what their priorities are. And then, you can really establish yourself as that community voice that you're looking to do. So I want to take a break for a moment and see if anyone has any questions or comments they want to share before we move on to what we call the bonus round. If not, let's move on to some quick questions. I'm not going to ask all 5 because we don't have time for them, but anyone can answer these, including those who are watching. So we touched on some of this stuff. We rely heavily on public schools to ensure kids have access to healthy meals. Has there been any discussion on addressing access to nutritious meals in the community if we continue to see an escalating number of children homeschooled or attending charter schools?
I'd say yes. There has been discussion. It's been one of my concerns from a policy standpoint with what I see as kind of a reducing the effectiveness of public education, is that public education has always been the one place where we can get eyes on children and we can see things that maybe are happening at home. Maybe it's food insecurity, abuse, neglect, these kinds of things. So as these opportunities to not be in public school are increased, I always have some concern that that's going to reduce change eyes on. And so it has been discussed. I do not know of any specific policy initiatives, but I know it's being talked about. And some of these schools don't have feeding requirements, right? They don't have transportation requirements. And so how that's going to play out is something that personally I worry about.
Okay, I'm going to jump to the next question. Thank you for that, Delegate Lovejoy. We've seen a lot of great work over the past couple of years in expanding farmers markets and pharmacies, as you had mentioned earlier, Delegate Lovejoy. Do you think there's an interest in continued support for them?
I do. Just from the people that I talk to, I mean, there's a program that's starting in MacDowell right now, and I think maybe some of these things take different looks and different versions depending on the communities that they're in. But there's a great thing that's starting in MacDowell County that's going to be a co-op, and I think there's a lot of people looking at things like that. So they're starting a grocery store, but it's a co-op. So you have people that come in, they really want to target high schoolers to come in and work, and then they have this whole farming initiative on top of it. So all the food that they get to this co-op is locally sourced in MacDowell and maybe some in Wyoming, but in the two counties, and they bring it back, and community members run the market, they give it out, and then the people that take it also work at the market. So I think, there's a lot of people thinking about this in very nuanced ways and trying to update the systems that we currently have of farmers markets, which aren't accessible to everyone. A Sunday morning or a Saturday morning for 2 hours, maybe that's not possible if you have kids. If you have a job that you have to work on the weekend. So I think there are very smart and dedicated people trying to make these things more accessible in very creative ways that we're going to see unfold. And I hope to see the state support those efforts too.
Thanks for that. And I'm thinking, so the next question is, who could be influential voices speaking to address community health at the legislature who we've not seen in this space? And when I think pharmacies, I think community health centers, because a number of our FQHCs have been partnering for this, the pharmacy program, but we don't hear a lot of them at the legislature. So, I think that employing or recruiting more people who work in that area would be an important voice. Can you think of any more?
Doctors. That's a very basic one. I don't think we see a lot of community physicians come to the legislature very often. We see researchers, we see people from WVU, professors. We do not see a lot of actual community doctors coming and saying, this is what I'm seeing in my community and how it's affecting the overall health of our entire community. I think that those perspectives would be really, really influential and effective. So I hope to see that in the future. And doctors really are the experts that we should be listening to on a lot of this stuff.
That's a great point. And I think that's something that at least I think kids were working on. I know that they're working to build a better infrastructure with the West Virginia chapter of the American Academy of Pediatrics. So we'd have more pediatricians available. But again, it's important to kind of have those conversations before session, because if you're just coming to testify, if you're a provider, you can rarely, that's always a shifting schedule, and trying to get them in front of legislators can be really difficult. Delegate Lovejoy, do you have any ideas?
No, I agree with you. I mean, everybody comes at this from different spaces. And I noticed when we were putting people together, some came at it from a health perspective. They're like, nutritious foods improve quality, quantity of life. Some people came at it from a faith-based, I feel a divine mission to minister to the physical needs of my fellow man. Some people came to it from an agricultural standpoint. Like, I have a district, I don't, but some people have district where there's lots of farmers. They're like, I have people that make food and I would like to participate in this food space. So I think that the more people you can involve, and even like business people that say, you know what, I would have a better time attracting businesses here if I have a robust community and grocery stores. And so, bringing everyone who has an interest it will rise. I think it'll raise the level for everyone. So think out, it's not just the people that are feeding people and the people that are hungry that have an interest in this. I mean, we all do. We got to think outside the box.
It's a good point. I was just thinking about the fact that we still have communities, rather largely populated communities, that are turning into food deserts. And we started talking about that a few years ago, and yet we still seem to be backpedaling on that. And so bringing some people in who are experiencing that would be, I think, powerful as well. I'm going to ask a question that we asked last week. It's a little variation of what I asked you. Last week, we discussed the potential of addressing transportation on the local level to deliver food to those in need. Transportation is an age-old problem with few solutions. So we have been thinking about trying to do a statewide transportation challenge summit where we all try and collectively figure out a way to address it, because if one system could address it, then you could work as a collective to address many of the things that need to, where transportation is a problem. So what other systems should be brought to that table?
Addiction and recovery. 110%. I mean, I sat in on an interim meeting on Tuesday that was talking about the Jobs and Hope program, but you can get people who are in recovery jobs if they can't get to their jobs because they don't have a car. A lot of people have had suspended licenses. They've had their licenses pulled because of certain infractions and stuff like that. I mean, that I've never ever sat in a meeting that has to do with addiction systems and transportation hasn't come up, whether it's getting people to rehab, getting them to harm reduction centers, getting them to counseling. It's really difficult. So I think that is a huge one.
That's a great idea. I mean, if you think about the systems in place that come near people, I mean, you have the mail, you have school buses, we have community groups that do Meals on Wheels, but there are some systems in place. Another aspect to that recovery, not only individuals in recovery, but I listened to a presentation. I think she was a PhD dietitian, or dietetics was her study, but talked about how good nutrition increases and improves recovery. And it got into some data sets of individuals going through different early recovery, middle and long-term recovery, and the amount of protein that in their diets. And there was a very clear correlation between nutrition and success in recovery. And so maybe if we start looking at that, and maybe that's more routing dollars, but it's a big piece of that. And there's so many people that just can't get to the food, and so we can have big piles of food, but if we can't get them to the people that need them, we really haven't accomplished anything.
Exactly. Thanks. Okay, one more question because we're out of time. What have we missed? What would you like to add to the conversation about local policy solutions that we haven't discussed? Anything left?
Organize. That's it. You're doing wonderful work out there. I mean, you're breaking your backs, doing everything to help people. We just need to talk more. It hit me one time on one of our work groups when somebody says, well, we got a problem. We can't even get the food. We have this food here, but we couldn't get it there. And someone was on the call and says, well, we run a truck through there every Thursday. We can just pick it up and bring it. I mean, we're going right by there. And so they're like, oh, that'd be great. And it was just because we were having a discussion. So think projects like this that are getting people talking and sharing at this level, but also on the local level, to say, hey, I'm running into this issue with cold food storage, or hey, I'm going to be taking a mobile pantry over here to this neighborhood on Tuesdays. The more we can have a kind of a continuum of care and all be talking, I think the more we can at least take what we have and multiply it for the biggest yield to help people.
Yeah, I think normalizing and continuing the conversations, talk not just to your lawmakers, not just to people that you're advocating with, talk to your friends when you go to the bar, talk to people that you hang out with, talk to your family, talk to anyone that might not even know this is an issue. I mean, it's I live in the East End in Charleston. I am walking distance to the Capitol, and we are in a food desert here. We don't talk about that a lot. And a lot of people that you run into, a lot of people around here have cars. There's ways to get just grocery stores and stuff, people might not realize the circumstances that they're actually living in until you start talking to them about it. And I think that has there's a lot of effect with that, of telling people, did you know that you can do this, but I can't, and I live right next to you. And that goes back to, reminding yourself of your positionality in a community and recognizing what you can tell people that they don't understand, and take the time to do that. Advocate for yourself, but also for your neighbors.
That's a great way to end the conversation. So we're out of time. Many thanks to the panelists, the Palatine Foundation of Huntington, our attendees, and for this great conversation. The video from today's discussion will be posted on our YouTube channel tomorrow, so be sure to share it with friends and colleagues who care about this issue. Thanks to all who joined us for all sessions. And in a few months, we'll share an issue brief with you about prevailing themes we've heard over the past 4 sessions and recommendations to build better connections between healthcare and food resource providers in rural West Virginia. We plan to have the issue brief ready in early September and hope to have a few community meetings in the Palatine Foundation of Huntington service area to hear your thoughts on these prevailing themes before legislative session. So thanks again, Delegate Lovejoy and Caity, and everyone have a good day.
Kelly.